diagnosing and explaining different psychological disorders. So if we're going to talk about a psychological disorder, what we're talking about is the definition of the mental processes and or the behavior patterns that cause emotional distress and or substantial impairment in functioning. So we're talking about a behavior pattern or mental process that causes the person emotional distress or possibly prevents them from functioning normally, okay? It can be either one of those things. When does behavior become abnormal? Because there is certainly behavior that is maladaptive, but is not necessarily abnormal. Maladaptive behavior would be waiting until 20 minutes before the final exam to start studying for the exam. That's maladaptive, but not abnormal. So where does it cross the line? And these are some of the questions that we look at as practitioners to decide if behavior is abnormal. Is the behavior considered to be strained within a person's culture? And these are, very serious things such as, packing all of your personal belongings with you wherever you go. That would be abnormal in our culture. In a society that's nomadic, it'd be completely normal to carry all your belongings everywhere you go. All right, and there's smaller nuances within this. Smiling at people you don't know, completely normal in our culture. In other cultures, it would be very abnormal. All right, so that's a very important part, is to consider the person's culture in which this behavior is happening. Is it abnormal in that culture? Does the behavior cause personal distress? Is the person bothered by this behavior or mental processes? Is the behavior maladaptive? Is the person a danger to themselves or others? Is the person legally responsible for his or her acts? And this is not necessarily a psychological or a clinical question here. What we're talking about is more of legal responsibility in the term of quote unquote insanity. Is the person responsible? Okay, so when we're talking about behavior, we're talking about it really on this continuum from somewhere between maladaptive and well-adjusted. When we are classifying and tracking psychological disorders, we use the DSM, and we are on the 5th edition of the DSM, okay? What the DSM is the Diagnostic and Statistic Manual of Mental Disorders. And it contains descriptions of over 300 disorders. It lists the criteria that's needed for diagnosis, and this is used by mental health professionals, researchers, and insurance companies. Okay, so this is a really big thing. The DSM-5 made big changes from the DSM-4. One of the biggest changes in the DSM-5 is that it makes the diagnosing criteria much easier for many disorders, which is a very controversial idea even among practitioners. So just keep that in mind. Public health officials are able to collect statistics about statistical data about these disorders, okay? And what we know from some of this statistical analysis is that about half of all Americans will experience some kind of psychological disorder in their lifetime. About half of Americans, okay? That's a pretty big number. When we're explaining psychological disorders, we look at it from different perspectives. Okay, the first perspective is the biological perspective. And this is where we focus on the physical causes, the genetics, the biochemical abnormalities or perhaps imbalances. We look for structural abnormalities, infections, all right? And because we are looking at this from a biological standpoint, we look at drug therapy as the main treatment for such disorders. When we are looking at the psychodynamic perspective, we're looking at psychological disorders that stem from early childhood experiences and unresolved, unconscious, sexual or aggressive conflicts. Obviously, this is the very Freudian view here, and if we're looking at somebody's unconscious, subconscious problems, obviously psychoanalysis is going to be the key to uncover what's going on in the subconscious. Wrong direction. Wrong direction again. All right, so the learning perspective. This is where we talk about more of how the person is thinking, how they're feeling, how their thoughts and behaviors are learned and sustained like any other behavior, and therefore is a failure to learn appropriate behaviors. All right, so the way we treat this, the way we approach treatment, is to use classical and operant conditioning. We use modeling to extinguish undesirable behaviors. All right, so if your response to a situation is maladaptive, what we need to do is change your thoughts and feelings and behaviors to learn a more appropriate and desirable behavior. The cognitive perspective, this is really where we go about the faulty thinking processes or the disordered perceptions that can cause psychological disorders. We want to address those things, all right? So what we're going to do is we're going to use cognitive therapy to change those faulty and irrational negative thinking. I've got an F and now I'm going to fail the class, okay? What you're doing is overreacting to one grade in an entire course, and it overcomes your thoughts and perceptions. So it's important to change that irrational and faulty negative thinking.